Just 10 years ago, it was hailed as one of the greatest public health achievements of the last century by the Centers for Disease Control and Prevention. Now, adding fluoride to public water systems is banned in Florida and being targeted by many other states as a health concern. Here to tell us about what's changed and the implications for your dental health is Dr. James Rutkowski, director of the Comprehensive Oral Implantation Program at JU. Dr. Rutkowski, thank you so much for joining us by video.
Oh, well, thank you for having me. It's a pleasure to be with you today.
It is a pleasure to talk to you. You've taught medicine now for many years. You've practiced clinical dentistry for 44 years. Are you surprised to see this change in attitude towards fluoride?
Um, by the general population, yes. The science has always been there it's been a well accepted fact for 80 years that fluoride at the proper dose is effective in preventing tooth decay. Dentistry is probably been the leader of all medical specialties in prevention. We've helped them through prevention, help improve the oral health of all patients by the use of fluoride. And so now for us to be considering or actually having taken it out of the water supply is a huge setback for us.
So we know that fluoride does strengthen teeth. It reduces cavities. I believe that it's credited with reducing tooth decay. This added fluoride by 25%.
Yes.
So what do you hear from your colleagues and people in the professional dentistry realm when they see this pullback happening? Is there an understanding as to why it's happening?
Well, it's shocking to all of us, or the vast majority of us, uh, because we are really there to help prevent disease. That's what the dentist is there to do, is to prevent disease, not necessarily to treat disease, not to do fillings, crowns, root canals, extractions, dental implants. We're there to help provide good oral health, and when there's a downfall, to repair those problems. But with the loss of this fluoride, it is going to increase the workload of restorative dentistry, and it's going to lead to more severe complications with tooth, teeth that are more severely decayed, patients having what we call soft teeth. And I've heard lots of patients say that have been in areas where they didn't have fluoridated water. Doc, I have soft teeth, and so my fillings don't work, my crowns don't work, my root canals don't work, and I get an extraction. So by having the fluoride in the water, we help prevent all those things. But now it's just going to open up the floodgates and increase all those problems for us. The vast majority of the dentists do not want this, even though you would think that intuitively, well, this is good for dentistry because it's going to give them more work. That's not what we're there for. We're there to do the work of prevention. And dentistry has been very effective in preventing.
I know that the Journal of the American Medical Association tried to assess the potential costs of pulling back from fluoridated water and the use of some fluoride supplements. And their research showed that it could lead to 25 million additional cavities, which seems like a really striking number. And that children, ages 0 to 19 would get, abundantly more of those cavities, but that it would also cost the country nearly $10 billion in terms of additional costs. And you were kind of getting into that. What are some of the ways that that could financially cost individuals or communities?
Well, the optimal time to give fluoride is probably from 3 months. To get fluoride is from 3 months of age, and even in utero, it certainly is helpful, but 3 months of age to the age of 8. That is the most effective time because that's when the enamel of the teeth are developing for you. And it's important that we get it topically, meaning through toothpaste, fluoride treatments at the dentist, but then also internally, where we take them, drink the water. It is absorbed in the gut, carried through the blood supply to the teeth, and mineralizing the teeth from the inside, making them harder. So if we go ahead and take that fluoride out in that time span for these individuals, we find that those that don't get the fluoride at that age are more apt to lose their teeth, all of their teeth, by the age 50. which now requires that they either have dentures or if they want something that's more stable than dentures, that they get dental implants. So these costs are quite high for people. And even if they just lose one or two teeth due to being soft and crumbling or breaking off at the gum line, and you need to get a dental implant or a fixed bridge, those are expensive dental treatments. And yes, dentists are very good at doing those things. They like to do those things, but we don't want to do them any more than we absolutely have to do them. And by taking the fluoride out of water, we will have far more decay. When I was in clinical practice, those that came to me from the farms where they had well water, and some well water does have fluoride in it, some well water has too much fluoride in it. Many well water supplies don't have any fluoride at all or very low levels of it. But those that came from areas of low fluoride had far more tooth decay, what we called rampant tooth decay, where it was throughout the mouth, as opposed to those that were in the city where they had a fluoridated water supply. Now, this does not negate the need for good oral hygiene.
I'm shocked to hear you say, to discuss the idea of someone losing all of their teeth by age 50. I mean, I think most of us, when we think about the impacts of fluoride or not having fluoride, is like a couple of cavities.
No, no, we're talking rampant tooth decay, especially in the younger population that will have no exposure to it whatsoever. That's who will be most susceptible to it. Now, if they were to practice excellent oral hygiene, go to the dentist routinely, get fluoride treatments, but all those things cost money, and not everybody avails themselves of that or has the money to do those things or the dedication to practice good oral hygiene. The act of prevention is the way to do it. Those that lose their teeth, studies show that they have shorter lifespans and they're more susceptible to dementia. So this is not just a dental issue, although that's major. It is a major health issue as well.
If you're just joining us, we are talking about the state and federal retreat from the use of fluoride. We are talking with Dr. Rutkowski from Jacksonville University. And if you would like to join our conversation, you have questions about dental health or a question for the doctor, you are welcome to join us. Give us a call at 904-549-2937. You can also email questions to First Coast Connect at wjct.org, or you can reach out on social media. We're on Facebook, Instagram, or Twitter at FCC On Air. We have a call from Charles on the west side. Good morning, Charles. Go ahead.
Good morning, Ann. Good morning, Doctor. You know, every time I hear one of these anti-fluoride rants, I started thinking back to Dr. Strangelove with the Colonel Jack Ripper going on about losing our purity of essence because of fluoridization in the water. What are the antis citing as evidence that it's harmful to us?
Doctor, to Charles's question, and I do want to get to the specifics of what the harm that people believe is caused by fluoride or excess fluoride, but I think it does speak to just kind of how far we've come, that this idea of, fluoridated water being something, sinister or harmful was practically a punchline, in that film, and now is truly considered a threat. Can you talk about that evolution? And then also, let's please talk about what the perceived harms are.
Okay. Well, first off, it's bigger than a soundbite. And unfortunately, there is a whole segment of the world right now that wants to base everything on a soundbite. They don't want to delve down into it deeply. When we're talking about the harmful effects of fluoride and individuals that are anti-fluoride, they are usually citing studies that those studies have concluded that fluoride is harmful. But those studies are either being misinterpreted or they are flawed studies. When we're talking about the harmful effects of fluoride, which is why people don't want it to be in the water supply, we're talking about toxicology. And my PhD is in pharmacology toxicology. And whenever we talk about toxicology, we have to talk about dose. And just by example of dose, Tylenol, a half to 1 gram 4 times a day will control arthritic pain. It will control chronic headaches. It will control postoperative surgical pain. Yet, if we take Tylenol and we give it a dose of 5 grams 4 times a day, it will be toxic and destroy the liver. But we're not talking about taking Tylenol off because people are understanding that there is a dose relationship there to the toxicity. Fluoride in the water at 0.7 parts per million is safe. Those studies that say that it's causing neurodegenerative disorders or lower IQs in the children, the offspring of women who have drink fluoridated water or have fluoridated water available. It's not even specifying how much water they drink. Most of those studies, they come from China, India, or Iran, where the water supplies are not well controlled, and many of those water supplies have excessive amounts of fluoride, maybe 3.5 parts per million, as opposed to the zero point 0.7 parts per million that we're suggesting. So, and also in looking at those studies where they're saying that it lowered the IQ of their offspring, in those studies, they did not consider what the IQs were of the mothers of those children. So the science is more than a soundbite. It goes deep. When you put a scientific project together, you have many people involved in it: epidemiologists, pharmacologists, biochemists, biostatisticians involved in it. Then once the data is collected, an independent biostatistician looks at that data, puts it together, analyzes it, and comes up with a result, a conclusion. There is no bias in a well-designed study. The studies that these individuals are citing to say that it's harmful, they're not looking at what is the dose that's given. Is it toxic or is it not? I can show you that just anything, too much water, drinking 1.5 liters of water every hour all day long will put you in a state of hyponatremia where you flush the sodium out of your body and it can kill you. But we're not talking about outlawing water. The extreme use of fluoride in water, drinking excessive amounts of water, would be a problem. But you would go into water toxicity before you would go into fluoride toxicity. So it's just not good science. It's based on sound bites. People like sound bites, particularly if the sound bite is anti-governmental or anti-establishment, then they go with that. So hopefully that sheds some light on your question there.
Yeah. I mean, we know that there is medical consensus. The American Academy of Pediatrics, the American Academy of Pediatric Dentistry, the ADA, the CDC, there's been this medical consensus. But there is, also the question of where to get unbiased information about a topic like this, one that has become so politicized, and also at a time when a lot of government agencies are increasingly politicized. And I think even just in researching for this segment, we found that to be a little bit confusing. You have agencies that at a time like the CDC, sang the praises of additive fluoride. But now you see agencies like the FDA coming out, and even some papers on the NIH website coming out talking about harms associated with fluoride, and they're perhaps referencing excess fluoride, but they're basically referring to it as additive fluoride, not necessarily specifying that it would be a toxic level of fluoride. But now saying that should not um, be added to water, or that supplemental fluoride, which is sometimes prescribed for people who live in water systems that are not fluoridated, that those prescriptions be banned, essentially, that people not be allowed to prescribe supplemental fluoride.
Um, good comments and good question. The best place to get your information on any health related or scientific matter is through the Web of Science. It's not doing a Google that may be AI enhanced, artificial intelligence enhanced with it, but going to the Web of Science. And the Web of Science only publishes peer reviewed papers. Now, even though those papers are peer reviewed, they have to be read and analyzed and critical thinking given to them. Because yes, bad papers do get published. Many good papers get published and some bad papers get published. And yes, science gets it wrong at times, no doubt about it. And that's why we have to go back and revisit it. So the current administration has instructed the CDC to no longer recommend the use of fluoride in water, although that is coming from a political individual and not a scientist. So go to the Web of Science. Don't just simply do it Google. But when you do get that Web of Science paper, you have to read it critically. I am the editor of the Journal of Oral Implantology. I review papers. That's part of my job all day long. I'm reviewing papers and looking at them critically to make sure there's not a bias in there. And yes, things do need to be reevaluated. Let's take a look at and do new projects on the levels that we know are safe, zero point 0.7 parts per million of fluoride in water. Let's construct some new research project. We're bringing all the experts together and looking and seeing, are we having any negative effects at these doses? But to overreact and just say, because we have found that there may be suspicion, okay, because there is suspicion, then let's do more studies. And that's why we need a good, solvent NIH led by good scientific clinicians, medically oriented individuals.
Dr. Rutkowski, I do want to come back to the Web of Science that you're recommending, and I have a couple questions about it, but I've got a couple folks waiting on the phone, so I want to take these calls just if we can. Jeff in Arlington, go ahead, Jeff.
Hi, good morning, and thank you very much for addressing something that's become a biting issue. Sorry about that. I just wanted to ask a question about toothpaste. Toothpaste is advertised as having fluoride in it. How much fluoride is in toothpaste, and is it enough? I'll take my reply offline. Thank you.
Thanks, Jeff. And I guess he means enough to, make up for the loss of fluoridated water, doctor.
Right. Well, that's an excellent question. It's a little bit of age dependent as to how much fluoride that you should get. If you have an infant and you're brushing their teeth when they start to come in at 6 months, that you should be using a drop of toothpaste that's about a seed, the size of a seed. And you should be trying to encourage that child to spit and not swallow. Okay. As the child gets older, like maybe age 2 to 3 and up, then they should be using one that's about the size of a pea. Okay. And again, spit, don't swallow. And once you get to be an adult, then you can put it on your toothbrush and brush. Now, the big thing is how long do you leave the toothpaste on there? Most people, studies have shown, brush their teeth for about 30 seconds. Well, that's inadequate. You should brush your teeth for 2 minutes. Obviously, those with fewer teeth, a young child doesn't have to brush quite as long, but an adult should brush for 2 minutes, 30 seconds per quadrant, upper right, upper left, lower right, 30 seconds each for a total of 2 minutes. If you do not swallow the toothpaste, there is no way you will get an excessive amount of fluoride, particularly as an adult. In a child, it is possible, but it's that the amount of fluoride that they get, even if they did swallow it, would not cause neurodegenerative diseases, but rather just a hyperfluorosis where you get white blotches on the teeth.
Okay.
Once you're an adult, that's not possible, although we don't want you to swallow that fluoride.
Gotcha. We
Now,
also, I'm sorry. Go ahead.
go ahead.
I,
No, go ahead. I'm sorry.
I do want to take a call from Sally, unless you have
Okay.
something else to add. I'm going to take a call from Sally in Springfield. Good morning, Sally. Go ahead.
Good morning. Thank you. And thank you so much for this really informative discussion. Dosage really does seem to be the key. But my question is to take responsibility for ourselves since things are falling away from us. Can you recommend good free or low-cost dental clinics in Duval and St. Johns County?
Thanks, Sally.
Well, I'm actually in Huntsville, Alabama at this time, so I'm not an expert on what's in your area there, but I would think that yes, there are, and many of the local dentists would probably know that answer. So you could maybe contact any of the dentists there, and maybe try 2 or 3 of them and see if they know of it. We do not have an undergraduate dental program in Jacksonville University, so we don't have one of those clinics. We have one for orthodontics in Jacksonville that does reduce costs for orthodontic treatment. You can maybe also reach out to see if you can find a local dental society, and they would probably know the answer to that.
All right. I want to take a call from Lisa in St. Augustine, just briefly, Lisa.
Hi. Thank you for having me on the call and for this interesting conversation. My story is anecdotal, I guess, and I'm not against fluoride personally, but I did live for a brief time in a small town in Massachusetts, and my next door neighbor was a scientist at MIT who had some medical issues, went to the doctor and was told he had a thyroid condition. He did a little investigating because he didn't want to take the medicine. There was fluoride in this very small town's water supply, so he stopped drinking it. He drank spring water, and his symptoms went away. So I think my point is that maybe some, overall fluoride's fine and effective, but maybe dosing
Thanks,
is.
Lisa. I'm just going to ask you because we've only got a couple seconds left, Doctor. Quickly respond to that.
Sure, yes. First off, I'm glad that his symptoms improved. And in anything in medicine, there are outliers, and we ought to always consider when somebody has a disease state to look at everything. And if changing the water, now it may have been the fluoride, but there may have been other minerals in that water that may have been causing it. So I don't want to make a direct relationship there. But anytime there's a medical condition, the clinician must look at all things and not be closed-minded to anything.
All right, we're going to have to leave it there. We should say our producer says that community health outreach does provide free dental services. Dr. James Rutkowski, thank you so much for being here today. Really appreciate it.
Thank you for having me.